Designing gender-neutral digital health in a patriarchy. So you've heard of the book Born a Crime by Trevor Noah. How many people here have actually read this book? It's a great book. If you haven't read it, strongly recommend that you read it. So I'll kind of like try to one-up him. I was born a gender fail. So, and for those of you who don't know, I'm the product of two Egyptians that immigrated to the United States in the 1960s to work with computers, and they decided to name me after the superintendent of the building that I was born in Queens' wife, Patricia, without thinking about the fact that one, there was no P in the Arabic alphabet, so my name is like butchered in Egypt, and two, that the actual name is the root or shares the root with the word patriarchy. So, gender bias in health is an age-old tale. I got into digital health and mobile health because of it. So my inspiration for getting into mobile health and studying mobile phones and health as part of my PhD came from an incident in South Sudan with a 16-year-old girl who was pregnant with twins that needed emergency obstetric care and transportation, and having to, at that time, I'm going to date myself, 1999, pre-mobile phones, two-way radio was what we had to mobilize access to emergency obstetric care for this young woman. And what we still see persistent in the health system is that medical misogyny is leaving women behind. We have incredible bias, and we know about this. And so this is my kind of fail, is that we keep identifying this sort of gender bias in various aspects of the work that we do, and things are not changing in any significant way. We also know that the gender digital divide has been with us from the beginning and is widening. So in my PhD thesis, I have text that speaks to the gender digital divide. I could not find female respondents to interview who had mobile phones. And so I had 70-something key informant respondents, and of them I had 8 females, and the rest were male. And this digital divide is widening. And so we also know that technology design is male-oriented. It's why we are dealing with all sorts of challenges and harms, including technology-facilitated gender-based violence and other things. And in particular, for things that are for women and for maternal, newborn, and child health, still a lot of the technology is being developed by men. And so I was commissioned to do an ethnographic study in 2009 for the MoTech project in Ghana. And as part of that research study, what we found was that women strongly preferred voice messaging. They wanted the voice of an elderly woman. The original design of the program was to do text messaging and to have the text messages be very medically authoritative. They commissioned the ethnography and they ignored the results of the ethnographic study because they knew better what was going to work apparently in Ghana. And so for 2 years, they implemented this program. And in the end, they redesigned the program based on the ethnographic results because the women actually said what they wanted in the ethnographic study. Women are underrepresented in data in general and in health data in particular. And so you have examples like Invisible Women. If you have not read this book, please read this book. You also have one of my fails was a program in Senegal when I was working with Millennium Villages Project, where we implemented the child count program, and then we were doing an evaluation of it 2 years later, where we discovered that in Senegal, we had pregnant men in the system. And so nobody was looking at the data. Nobody was actually using the system effectively. And so 2 years of implementation of this program, we had pregnant men. So this week, I have been here in Geneva, and I have been told on several occasions that gender is a nice to have. What is it? And so I asked ChatGPT. And so this is ChatGPT's response. Sure, gender is a nice to have if you're okay designing digital health solutions that work great for half the population and fail the other half. But if you're into impact, equity, and not wasting millions, then it's actually a must-have. And this is data from the Global Digital Health Monitor, where we know that gender is not being reflected in digital health strategies, policies, and programs. And so apparently advocating for the ecosystem to do the right/fair thing for the sake of doing the right/fair thing for 20 years is not working for the patriarchy. So I have been told that we need to take a different approach. Apparently, we now need to share the economic impact of not doing the right/fair thing. In the last 3 months, I have seen reframing of things like gender-based violence into loss of productivity and money, which is horrifying. But if this is what we need to be doing, then maybe this is the learning and the takeaway, that maybe people will respond to either loss of economic opportunity and or potential for economic gain. So what should we all be doing about this? Here's my call to action. Embed gender in every line of code and include women as developers of code. My mother is a computer programmer and my father is a computer programmer. And the two of them, when I was growing up, my father would give his code to my mother to review for him, because the way he described it is that he would come up with a solution, but she would come up with a much more elegant solution. And she would sit with it forever until she found the right way to do the thing. Shift power, not just practice. We did a gender study in Ethiopia recently. They have a national digital health gender strategy. It is not translating into operationalization or change on the ground. And then measure what matters. Measure gender transformation in health and in technology, in the outcomes, not just in the inputs. So thank you. Let's smash the patriarchy.